morning, Sharon.
Hi.
I was just wondering if I could talk to you about one of my patients.
Okay.
So her name's Rosa. She's been in and out of the hospital. She has a diagnosis of bipolar disorder,
Okay.
and she's been in and out of the hospital, and she's now getting transferred home. And so we've had some CCAC nurses and different people, part of the healthcare team, visiting her. And I just wanted to kind of get your opinion on her and, like how we can maybe work together to help her. Do you want? I'm just going to give you a little bit of background information first.
I think I know her, but you can actually say that's Rosa, right?
Yeah. So
okay.
Diagnosis of bipolar. She was married to her husband at 17, and she had her first child at 19.
Okay.
So young. And then she immigrated to Canada. So she has 3 children: Nick, Lucy, and Tony.
Okay.
Nick's the oldest; he's 25, and Tony and Lucy are teenagers. So what I've gathered from the history is Lucy is the daughter. She does most of the cooking and cleaning, and Tony does the finances. So he actually works with all the money in the family and is comfortable with that. Rosa's also very religious. They go to mass every Saturday, and they're Italian. So like I said, she's been in and out of the hospital a lot, so we just want to make sure that we're following up with treatment and making sure she's transitioning well.
Okay.
Yeah.
Well, I think I know a little bit about this family. There've been some concerns because I was called up by Child Aid Society to go to one of the daughter's school, the 15-year-old.
Okay.
And that was because I think during when they were playing, she kept on saying "ow" on her arm, her right arm, and they had to take her into the office to observe because they do have a nurse there. And when they did assess, they found some bruises there. So this actually made they wanted someone to go to the house to assess them. So I've actually visited this house once. When I went there, the environment, I don't feel it's safe because I found the patient passed out on the couch. She had half bottle of vodka, which was open. She also had prescription pills, Percocet, lying around.
Yeah.
So for me, for a teenager, to have teenagers in that kind of environment where there's nothing controlled and the only adult there is actually passed out half of the time, I feel that's not a safe environment to have the kids there, the teenagers there. So now my aim is actually to try and temporarily remove them from that environment. Okay?
Yeah. So I get where you're coming from. I see that, walking into that kind of environment, it really is not conducive for the children, and it also doesn't look good, and it doesn't look like the mother, Rosa is functioning healthy and taking care of her children. However, I do think that because it was one time that you saw that, I think maybe it might be a little too intense of a reaction to just pull the kids away. I think that might not be conducive to their health, and I think it might cause a lot of pain and anxiety between the mom and the 2 younger kids.
I do get that, where you're coming from, but one time for us, in my book, that's enough, because who's to say like the 15-year-old or the 13-year-old wouldn't have access to their and just overdose and drink it? That's so unsafe. So in my line of profession, I'm not going to wait till it happens again and it happens again before I say, oh my God, there's a problem. So right now, it's, for me, from my perspective, we need to nip it by the bud.
Yeah, I agree. I think one time is enough. But I think there's other ways to maybe go about it other than removing the kids right then and now. I think maybe we can look at some other people we can look to some other people in the healthcare team, get their opinion, see if other nurses have been working with them, and if they've noticed the same kind of behavior. I think there's other things we can do. We can talk to Rosa. We can talk to the kids and see how they're feeling. I think because of their age too, Lucy and Tony, I think it would be good to talk to them because they are teenagers. We can see how they're feeling. They do have a voice, so I think we can look into, if they feel like they're not safe or what they would want to do. I think that would be more healthy.
Has the patient had a family meeting set up since she's been admitted?
You know what? I think she had one when she was first admitted, but since what you're telling me now, I don't think she has had one.
Okay, can you actually mention that to the doctor to see if they can set up a family meeting? I can
Yeah.
actually, on my way out, I'll talk to the charge nurse.
Yeah.
And so we can have a family meeting set up. Then the son, she has a son 25 years old.
Yes.
So the son has to be present for that meeting.
Okay.
And how soon can we get this done?
You know what? We can get on that immediately. I can, as soon as we're done here, I can go and talk to the doctor and get on it, because it is a situation that needs to be handled.
Yes.
Especially when, you know, we're looking at the safety of the children and the patient.
Okay. All right.
Okay.
I'll wait.
Thank you for talking with
You're
me.
welcome.